let's get straight to it because I know why you click. You want to know how much do medical coders really make, not the sugar coated Google version that says the average salary is blah, blah, blah. Nope. We're getting straight to the real numbers today. Because listen, some of y'all out here thinking y'all about to start this journey into medical coding and y'all go start off with like 70K fresh out of school. But I hate to be the bearer of bad news. That's not reality. It's not going to happen. Not in the beginning. But, and this is a big but, medical coding can be a very high paying job if you play your cards right. You just got to understand what factors really affect your pay so that you can strategically plan your career path and level up. So I'm about to break it down for you. No BS. Let's just get to the real. All right, so here we go. One of the biggest misconceptions about medical coding is that you're going to start off making the big bucks. And now, serious medical coding can be a high paying career, but that's not how you start. Your starting salary will really depend on your experience. It'll depend a little bit on your certifications. It also takes into account the type of facility that you work for and the specialty that you code in. Most new coders start off at about high 40s to mid $50,000 per year, somewhere around $19 to $25 an hour. You might see people claiming that they got hired and they started making 70K right away, but that's probably because they already had some kind of medical experience or they already came from like the clinical side of healthcare. So they pay maybe a little bit higher because of the experience that they brought to the role and maybe because of the type of background that they have. Okay, now if you're brand new, you're probably going to be in that 48 to 55K per year range. But once you stack some years and you get some experience, that number can possibly go up pretty quickly. Mid-level coders, those that have around 3 to 5 years of experience, they probably can command about 60 to 75K. Senior coders, those ones that have 5+ years of experience and have specialty in certain areas, they can command about 70 to even 90K. Those are like your revenue cycle managers, your experienced surgical coders that code complex procedures, also your auditors, and maybe your educators. So just stick with it. It depends on your years of experience and your knowledge base. And yes, it is true that some of those coders do hit six figures. Listen, certifications are really nice, but they don't automatically mean a higher pay. If you have a CPC and a CRC, but only have 1 to 2 years of experience, don't expect that to increase your salary from the jump just because you stack some letters behind your name. But if you have those same credentials and you couple that with 5+ years of experience, then you can start demanding the higher pay. So don't just start collecting credentials like Pokemon cards. Get the hands on experience too. That's the key. And where you work matters. Clinics, they usually pay the most for W 2 employees, in my experience. Hospitals pay pretty good too, but the real perk there is that they will cover like your CEUs, your books, and usually put you on their corporate membership. Insurance companies and government jobs, those were the real salaries at, but they expect you to bring a deep level of knowledge to the table. Private practice, if you're working as a freelancer, your rates can vary because you make your own rates. But that is the ticket to getting paid way more than salary coders if you play your cards right. Remote work is normal in medical coding, but that doesn't automatically mean higher pay. Most remote jobs pay about the same as office jobs, but be aware some places still require you to come in occasionally due to privacy laws. HIPAA ain't playing with patient data, and neither should you. So be open to working a hybrid schedule, especially if you're a new coder and you're trying to get your foot in the door. Okay, here is the secret sauce to being able to make 100K in medical coding and billing. So if you want to maximize your earnings, you're going to have to look outside of a 9 to 5. Get you a side hustle. Freelance and medical billing services. Private practices are willing to pay for billing help. Or be a consultant. Teach a billing team how to clean up their denials and how to get those claims paid. Or you can offer tutoring and mentorships, helping new coders to pass their CPC exam and create a career for themselves. Or teach. Train coders at trade schools or online. The highest paid coders don't just work a 9 to 5, they actually own something. So get your side hustle on and level up that money. I can hear some of y'all screaming at the screen saying that I ain't trying to do no side hustle. So if you want to make 6 figures as a 9 to 5 coder, I'm telling you, you're going to need 10 plus years of experience and be in advanced roles like a trainer or auditor or even a revenue cycle director. Specializing in complex coding areas will also help you do that. Or start your own business. That is going to be the fastest way to make it 100K in medical coding. And while we're talking about getting 6 figures in your 9 to 5, if you feel like you're being underpaid, don't just sit there, advocate for yourself. I always say use a brag book. Track your accomplishments and any feedback that you get from your medical provider. And when you are speaking with HR, ask for more than what you expect. HR will always lowball you first. And also be willing to leave. The fastest way to get a raise is to switch jobs. The only way you're going to get paid what you're worth is if you demand it. Always be willing to negotiate your salary. Always go in confident and expecting to get paid what you deserve. You have talents that deserve to be looked at and noticed and appreciated. So demand that pay. So I hope you enjoyed this real breakdown of how much medical coders make. If you got value from this video, make sure you like, subscribe, and drop a comment if you have any questions. And if you're serious about leveling up your medical coding career, check out the link in my description. I have a CPC review course that I have created. I also have a playbook on how to get help in test taking strategies for the CPC exam. I also have a guide on how to get started in medical coding and a bunch of other resources down there. So go ahead and check out the link in the description. And as always, keep on leveling up, and I'll see you in the next video.